We'll go ahead and call this meeting to order here. This is a special meeting with the Board of Directors for Fallbrook Regional Healthcare District. If we can have a roll call.
Director Stanison.
Here.
Director Mraz. Present. Director Leach.
I'm here.
Director Jeff. Here. Director Brown.
Here.
We have quorum.
Awesome. If we could stand and give the pledge. Ready, begin.
I pledge allegiance to the flag of the United States of America and to the republic for which we stand, one nation under God, indivisible, with liberty and justice for all.
Okay, can I have a motion to approve the agenda as presented?
Second.
Okay.
We'll give it to JJ and we'll second part.
Thank you.
Any discussion on that? Seeing no discussion, if we could have a vote on that.
Director Stanison.
Aye.
Director Mraz. Aye. Director Leach.
Aye.
Director Jeffrey. Aye. Director Brown.
Aye.
Thank you.
Thank you. We'll move to public comments. This section will give 5 minutes of public comment to anybody that has in this portion on the agenda. It's for items that aren't on the agenda. So if you have a comment about the grant or any of the grant process, just hold off and I'll let you have a comment at that point. Are there any comments here that aren't agenda items?
You want to wait, Christine, until after? Okay.
Okay.
We only had one public comment in regarding the grant, so we'll do that after the agenda item.
Okay.
Anybody online?
It will not share the agenda on the screen for whatever reason.
But is anybody on?
There is no one else on Zoom, so.
Well, I'll go ahead and close public comments. We'll move to discussion items. This is D1 Community Health Grants, contract scoring and awards for the fiscal year 23-24. At this time, I'll open it up to public comment for anybody that has comments on this issue. Like I mentioned, if you give 5 minutes roughly, and one comment per person. So do we have anybody that would like to give comments at this time?
Yeah, so Christina has already asked for a moment to speak, so. Yeah,
Ben,
you can, right, yeah, unless you want them to come in forward.
Well, here is fine, wherever you feel comfortable is fine. Yeah, absolutely.
I don't feel comfortable in front of people.
Okay, I just wanted to, my name is Christina Perano and I'm here on behalf of Voices for Children. And I just wanted to really just thank you we're a first time applicant and wanted to just mention how glad we are that you're considering our application. And then just wanted to share a little bit more about Voices for Children and have a chance to read it, but just that we're an organization that provides special kids and children in foster care, and just how important that is. A person who is not a social worker, not paid for in any way, shape, or form, just a community volunteer who's been trained and supervised by our team to make sure that a child's voice and concerns and best interests are heard, because once you enter foster care, a judge makes decisions on what will happen for you based on their limited knowledge of that child. So just how critical that is. And we're so grateful for you considering our application to support behavioral health services, mental health and physical health services that children in foster care need as a result of the trauma due to abuse and neglect that they experience before they enter foster care. So anyway, that was the purpose of my, I just wanted to say hello and thank you very much.
Awesome, thank you. Do we have anybody else who would like to make comments before we start the discussion? Anything else? Okay, seeing none, I'll go ahead and close public comments. And then we'll move to, I guess, board deliberation of some of these. So everybody has a copy of the grant scoring sheet. It does seem like we have a good amount of consensus on a number of the grants already. There's also a number that are kind of in the middle, and then there's some that we have that there's definitely some discussion on. I would I guess start by allowing any of the board members to pull an item if they'd like to discuss any of the grants in particular, or their thought process or, you know, I'll open it up to the board if you guys have any comments on that. And then, I guess we could go forward and, possibly look at the groups and kind of move from there. I think that, obviously the group of grants, it's in the green. There's a pretty broad consensus there. I think that there's probably, more room for discussion in the orange and the, I guess it's yellow and, red sections. And then I guess we can go from there. Terry?
I would just like to propose if we could, if we could just take each item and just, call it out and see if there's any discussion about that particular item, even though we have a good consensus on a large number. One in particular that I would like to talk about, even though it's in the green. I think it's a rare occasion when I don't think someone has asked for enough. Okay, for what they're proposing to do. So if we could do that, I mean, that would be okay with me if it's okay. Because I don't want to be here all day long, obviously.
Sure.
Can
Okay,
I ask
yeah, absolutely.
Okay, so I want to be clear, the first round of discussions has to do with the merit of it, but not necessarily the amount. And then we move to amount.
Okay.
Because we've got to look at the whole before we know proportionally what we can give. So I just want to clarify the process. We're talking about whether something should be ranked higher or lower, and
Correct.
then when we see the whole, we go to amount, or if we're doing it a little bit.
Yeah, no, I think that the first time around, will give everybody an opportunity to kind of give their comments on it, and then we can kind of go through the process of approval and, you know, if there's any grants that we're trying to limit the amounts or change the amounts or any of that. How about this? I'll open it up for the green section. If anybody has any comments on that top section, let's go ahead and pull those items now and we can discuss. Terry, do you have anything in that?
Well, I did. I actually asked him. With regard to the Foundation for Senior Affairs request for their door-through-door program. As I understand it, it is a program intended to help those people, in particular, seniors who have been in the hospital and then coming back home, and to keep them from having to have a relapse and have to go back to the hospital. Rachel had sent us a copy of a motion that was passed by the San Diego County Board of Supervisors, having to do with a similar program that Supervisor Anderson had gotten approved. And it has to do with partnering with Rosemont Hospital District and them agreeing to fund a program specific to reaching out to seniors who've been in the hospital, and then having a team of, I believe, a nurse or some kind of a social type person and someone from the paramedics to go out and visit them at home for the purposes of making sure that they are safe upon their return, that any obstacles or unsafe situations can be remedied to keep from going back to the hospital. Part of the proposal by Supervisor Anderson indicated that there was just a lot of money that was being spent on people going back to the hospital unnecessarily because they had been discharged from the hospital too soon for an unsafe situation. So this is one of those where I think it's right up our venue. It's what we do from my perspective.
Yeah.
And to be able to, number one, help this particular program do more for Fallbrook in North County. And maybe as a side motion for us to consider some kind of contact or working relationship with Rosemont Hospital District or even one of our other two hospital districts to partner with that kind of a program. I'd be thrilled to fund that kind of a program. Yeah, if it meant keeping our seniors out of the hospital, we don't have a hospital anymore, but we can certainly do our best to keep them safe and keep them healthy.
Yeah,
that's just my opinion.
Yeah. Well, I would definitely agree with that. I mean, I think Both Your Door is definitely a program that we funded for a number of years. And I think that, you know, I remember personally presenting about that program in Sacramento in probably 2018. I mean, it's been a long time, but I definitely agree. I think it's a good program and, that type of service is definitely something that, should get looked at, expanded, it's a common sense sort of approach to preventing, recurrence in hospital, intake. Do we know, why the amount is the amount? It seems like it's a little lower than typical. Is there a reason that you know of, Rachel, or anything?
Well, you could direct the question
Okay.
to Patty,
Hi,
the
absolutely.
ED at Foundation for Senior Care Services.
Yes, good morning. A couple of reasons. Primarily, last year, the amount that we requested wasn't significantly different and it was cut even less than this. So I thought if we went much higher, you weren't gonna approve it at all. So I was being very conservative with what I was asking in hopes of getting approved what I asked.
Understood.
And I no longer have a full-time coordinator doing that. 2 years ago, we had a full-time person doing that. But with cuts in funds, I couldn't afford it. So now it is just, I'm spreading it. I have a lead that takes a good portion of that time, and then the other two advocates that we have help. They work very closely with Temecula Valley Hospital. That's the closest one. And that is a regular occurrence. I mean, every week, I don't know how many, 4 or 5 people we get called either from them, from family members, or from North County Fire referrals. So it is an active program still. I would love to see it more active with Palomar Health and with Tri-City, our local hospitals. So that's an outreach effort. But I was really being conservative so that we would at least get some funding for it. I
Gotcha.
didn't know whether you would be supportive of the program.
If I could ask, have you reached out to any of the hospitals for any kind of support? It's my understanding, Barbara, you can correct me if I'm wrong, with regard to hospitals, they're penalized financially by CMS, Medicare for the rehospitalization rate.
Yes, they are.
And that went into effect like 10, 12 years ago. And they can get penalized a lot of money if they're exceeding a certain percentage of returnees. And for Grossmont Hospital, as I read the proposal by Supervisor Anderson, they were just ponying up like $60,000. Well, from my perspective, that's really kind of a spit in the ocean from which they're on the hook for rehospitalization rate. So, but I was just wondering if you
I
had
do need
any.
to make a clarification. It's the health district that is funding it, not the hospital. So the hospital is sharp, but the hospital is not actually part of the proposal. The care is actually coming out of, in part, CAL FIRE. So that's why this is a pilot program and we're waiting to see how it is. But essentially, Grossmont's health district grant funded the pilot.
Understood.
Yeah.
Understood. The point is, they should fund it a heck of a lot more in my perspective.
Yes, agreed. And we have reached out to them to see if we could go do an in-service, and basically all of their case managers and discharge planners said, there's not a forum here for that. You really can't, there's not a place for you to come here for that.
If I may ask, are your clients part of the medical groups that are established as the primary caregivers here in Fallbrook, like Regal Medical Group or Graybill?
I don't know specifically. I would imagine a good portion of them are.
Okay, because I think that this is an opportunity to reach out to them and tell them it is their responsibility as well for discharge planning and an aftercare program. It would behoove them to get on board with this program and to support you because it only promotes positive outcomes for them. They have been capitated for dollars for the care of the patient, and I think that allocation of those dollars should be appropriately distributed to the care of the patient when it's necessary. And the problem that we have is that we're not the hands-on hospital as we used to be. So we're looking at the encouragement to protect the positive outcome of the discharge patient so they don't fall between the cracks. And this can only benefit the community as well as the doctors because then they have better case management. And if they haven't addressed the fact that they are sorely lacking in participating in aftercare and case management, maybe a loud voice in their direction is necessary at this point in time. So I'm all for it. That's my humble opinion.
They are.
I'm not sure if we can do anything about changing the grant amount.
We can't really,
Yeah.
due to the way that the grant contracts are written, we can't really change it. What we can do if the board is, you can direct me to continue the conversation.
Yeah.
We could look to expand this into more of an MOU format.
Yeah.
For ongoing services. I know that that is on our May strategic planning agenda.
Yeah.
So we could move an ongoing, that would more mirror that pilot. And move that to that level of conversation.
Yeah.
But within the current structure of the grant contracts, we can't really make that level of amendment without really a substantive change to the contracting process.
Yeah. I mean, as long as the board is amenable to that, I think that that would be a good option to explore and potentially maybe JPA with one of the other districts that's potentially interested in that. I mean, I think from my perspective, this is a program that we've promoted and that we've been proud to support for a number of years. And, you know, especially with the current grant rules that only allow 3 of the same grants in a row, I think that, you know, this would be one of the programs that we would be interested in continuing and supporting.
Okay.
So,
Then, just, I don't think we need to make a motion. I'll go ahead and just follow up with, Patty, get a little more information. And then we'll move the entire conversation around the process of it
Yeah.
to that May meeting. That should give us enough time to put in a few other pieces. And I can double check with council to make sure that we have a clear set of boundaries and guidelines on that as well.
awesome.
If that
Thank
will
you.
work.
Okay, do we have, you have anything else for any of the good ones? Jennifer, do you have anything for?
I'm good on green.
Barbara?
And before we get started, I would just like to ask Rachel to do a little recap as to how we arrive at assessment of these grants. It's not that your program doesn't have merit, because each and every one of them has merit. They're great ideas. I know that for your organization, you put a lot of time and effort into it. But for whatever reason, perhaps that criteria has not been met. And it's not because it is not a program that doesn't have merit, but we are bound by certain criteria. And I'd like to let Rachel expound on that just a little bit before we get started.
Sure. So as most of the grantees know, when we do our grant training, there are some very specific goals and objectives that we ask you to write to, including being able to have clear measurable outcomes. The measurable outcomes is a large part of the scoring of this, but it is just one section. The other part is clear program processes, procedures, understanding how you get in, how an individual gets into the program, what the intervention or services are that you provide, how it's provided. Then there's also the budgetary component. Is what you're proposing to do feasible within the budget that you propose, not just the budgeted ask from the district, but within that budget as well. So all of those pieces are put into a number of scores. So the scoring ends up being 60 points, and that includes everything from talking about your mission, your history, your capabilities, diversity in funding. If the district is the only source of funding, that is obviously problematic, as has been discussed in the previous training. Making sure that you're covering our service area, things of that nature. So all of those pieces that were discussed in the training that was put forward to the grantees is part of what builds into the scoring that the board does. To echo Barbara's comments, your programs may be lovely and do great work, but if the grant wasn't written clearly to explain that, your score may not reflect the importance of your program as you see it, because it wasn't really able to be communicated well in that format.
We are limited to services provided in our district, which would be Fallbrook, Bonsall, Duluth, and Rainbow, and the number of participants or service members that would be receiving your services. So just keep that in mind as we move forward. And again, thank you again for taking the time to submit the application, because what you're doing certainly has been making our community a lot stronger and healthier. So I thank you.
Would you like to pull any of those grants in the green, or you're?
No, we can just move forward.
Mike?
I'm good with green.
Okay. How about, the next section? Terry, anything in the next section?
Um, nothing that really stands out to me at this point. Yeah, no, I think I'm looking forward to you guys.
I'm good with Marigold.
Awesome, yeah. Yeah, I don't really have any comments here, but Barbara,
No, I'm good.
Mike?
No, I'm okay with those characterizations and categories.
Okay.
Mine as well.
Awesome. Well, the last, one, I definitely think that there's some variation in scores. Again, we'll, we'd like to pull one of these and discuss if you gave it an exceptionally high or low score, or you think something, in particular about it. Now would be a good time to kind of discuss the merits of the application and all that. Terry, anything there?
I guess I have some thoughts with regard to the range program. I've seen how we funded it in the past. I read the grants. I just have some thoughts that that's not really what we are charged with doing. I think that you could take any program and stretch it out where there would be maybe some benefit in a health sense down the road. But I think that we have a responsibility to put our money on things that work more readily available, obvious, productive, measurable. And if you look at the cost per participant in this particular program, it's very, very high. So that's just my thought.
So anything else in there?
I don't want to take anybody else's thunder. Start at that end of the table.
What do you got here?
Well, although finding merit in each of these, this does reflect my sense of my ability to clearly understand objectives, goals, and measuring, especially measuring. They weren't clear enough for me to feel that I wanted to advance them forward.
You can skip me, I'll go last. Barbara, do you have something here?
No, this just, I think, again, reflects the areas that were the most challenging to go through for an evaluation, because for one reason or another, there were certain criteria that were not specifically stated in the grant application. Maybe the service area, perhaps the number of recipients of the program, or the fact that the program wasn't clearly outlined to show where these dollars would be going for specific performance for the program outlined. And one of the most critical points is the measurable outcomes. And I know this is really hard, especially when it's a new startup program. So for those who did enter into this area, which was challenging, I hope that we can work through some of these things. And that we can assist you in moving forward with these programs, perhaps not at the amount that was requested, but perhaps at a different level. The other thing is on number 11, this Hope Clinic for Women, and this is something that speaks to my heart. I think this is a wonderful program. I would love to see it all encompassing for not only the women, but the men as well. But this poses a challenge to the district as well, because we know that most of our members in our community have primary care physicians, or they have access to the clinic, Fallbrook Community Clinic. And we have done a lot of support. We've given a lot of support to that community clinic for programs such as this to better assist the young people or those people in the area that are being challenged with these concerns. And so we have to be careful about a duplication of services as well. So with that, I just want to say, again, the idea, fantastic. But perhaps it may not be meeting all the criteria that's necessary for us to move forward to fund it at that amount. So again, thank you for submitting it, and we will definitely take this under consideration as we move forward today.
Director Sanisek?
Yes. So, having gone through the process for the first time, first, I know there's a lot of work involved, everybody put these together, and I had a lot of fun reading them, getting to know all the organizations much more clearly. As I was going through the process, I was clearly looking at where our mission and umbrella sits for the community. And that was a key factor, as well as the program metrics, measurements, and keys to success. And as I looked at the stack, I had the similar type of comments about potentially some of the grant requests, and my question always came up, what would the next $20,000 do? How would it close gap in service? How would it help the community expand or grow the program even more? And I was kind of wrestling through that as I was reading all these. And when I looked at the RAINS programs, I know they do excellent work there. And I've been on site, I've seen what they've done. But it's just, for me, did not fit well within our charter in terms of what we're trying to cover with all the gaps that we have in terms of health providing. And also the measurement of the programs and the objectives were not as clear as some other grants. So that's why I kind of put it down the list a little bit, especially with the amount of money that's being involved here in terms of service that could be provided elsewhere. So that was my perspective.
Thank you.
Yep.
So for me, a couple comments that I'd make, is that, I think like a lot of the other board members mentioned, I think that there's a lot of good programs out there. I would, personally, recommend, possibly hiring somebody to do grants, getting more education on how to write the grants. I know we provide the, education here in the training. Some of the grants were written in a way that were hard for us to justify, like they're saying, the actual outcomes. And from our perspective, we get funding from tax dollars, and the regulators look at us and they want us to be able to justify this is why we're providing funds for different programs. So it's really critical to be able to provide some sort of data, or to give us some sort of outcome that we can look at and measure and represent to the public. However, I think that there are some programs that it's kind of difficult. I mean, I hear what the other board members were saying here about RAINS. I think my personal opinion of a program like that is that it's incredibly beneficial to a specific community, which is basically the special needs community. I think that as a district, we should probably be looking to advocate for them. In the past, we've funded other groups that did similar sort of programming. I think that something like horse therapy is, I think it's pretty well proven that it's beneficial to certain subsets of the community. Although it might be a little difficult to be able to provide exact data. This is how much it's helping. I think that something like that's definitely a little bit challenging. Personally, I liked that grant. I think that that's a program that we've supported for a number of years and would be comfortable continuing to do that. Some of the other stuff, like I said, I kind of agree with the board as far as we're trying to score it in a certain way. I would again advocate, try to come to more of our board meetings, like if your grant doesn't get approved, so you get a better idea of what we're looking to do, what our objectives are as a board. You probably have a better idea of like what we're more keen to fund. I would probably give you a better idea of that. So that's just basically my 2 cents. Beyond this, did you want to go to yay or nay on
Yeah,
different sections?
I think at this point it would probably, if you're comfortable with your level of discussion, I think now if you want to break them into section and approve by section, or make recommendations or changes by section, I think that's probably a clean way to proceed.
Okay. Can I have a motion to approve the green section?
Including the amounts listed.
We can just approve first and then
First,
go over
and then go
the,
back.
go back over the amounts if that's okay. And if you have any that you'd like to pull, we can go from there, but if we get a motion to approve that, that'd be good.
I move to approve the programs listed in the green section.
I'll second.
Any discussion on any of those?
Nope, I'm good.
Okay,
Director Stanica?
Approved.
Director Morales?
Aye.
Director Leach?
Aye.
Director Jeffries?
Aye.
Director Brown?
Aye.
Thank you.
okay. Moving forward to the next section, we'll do the same sort of process. We have a motion to approve those programs. Okay,
I'll make the motion to approve the boys and girls programs.
is it this section that you're looking here? We're looking for the orange section.
Oh, I
The
beg
yellow.
your pardon.
Okay.
Which, sorry, shut down, redirect.
Okay.
So are you still making the motion to approve the yellow section?
Yes, we're moving into review of the yellow section, correct?
Yeah.
That's fine.
Yes.
Would you like to motion to approve?
Yes.
Any second?
I'll second.
Okay, discussion?
Well, there's at least one in there, I think that, voices for children. I understand exactly what it is. And I think it's absolutely laudable. My sense of it is, I read through it, there are other county supported and paid for programs that do that. I just don't see that being a Fallbrook Regional Health District project, something that we should be spending. There are other funds available from other sources. I get it. I'm a foster parent. I've had 5. I get it. It is not, it doesn't fall under our role, in my opinion. So just to throw it into free, I can't do that.
Understood.
One vote.
Any other discussion on any of the items?
I would look at it in an additional way. And thank you for being a foster parent and knowing people in voices just through school district work. I would say in terms of mental health, which I do believe is in our wheelhouse, and the reasonable amount that they're asking for this effort. Also fitting it into the larger system. Cal State San Marcos has had great success with their ACEs program, which is former foster youth going to college. So I think it's a bigger picture that I would support this program. It's our first time, I believe. We only have three programs that are initiating new ways to help our community. I think that's important for us to pay attention to. So I would be supportive.
So, any other discussion?
Not at this time.
Okay.
Thanks.
Seeing none, I guess just go to a vote on that section.
Director Brown?
Is the motion to approve the yellow section, is that it?
Correct.
No.
Director Jeffries?
Aye.
Director Leach?
Aye.
Director Morales?
No.
Director Stanica?
I think it's a no for some additional trade-offs between the category that we've
Thank
been
you.
discussing.
Can I have a motion to approve all those ones besides Voices for Children? Is that the holdup that we have?
I would support that motion, allow us to move voices out for further discussion.
Okay,
So I move to approve all programs in the yellow with the exception of Voices for Children for further discussion.
I'll second.
any discussion on that? Seeing none?
Director Brown?
Approved. Aye.
Director Jeffries?
Aye.
Director Leach?
Aye.
Director Morales?
Aye.
Director Stanica? Thank you.
Okay. And, wow, so we have the last, section here. I don't know if we're gonna be able to have a motion to approve them, in total, but, do we have, a motion on any of the individual programs? I would make a motion to support the Reigns, UL volunteer program. I think that it got, some decent scores. Like I said, I think that, that particular program, it's hard to quantify the exact impact that it has on, the community, but, from what I've seen and the research that I've done, it seems like, it's a, therapeutic, proven program that definitely helps, and, that would be my take on that.
We need a motion before we can discuss.
Okay, then, well, that's,
How do we do finance?
I would make a motion to approve, grant number 21 and, approve that program.
I'll second for discussion.
Okay, any discussion?
Yes. Okay. I agree with everything you've said about the therapeutic effect and the provenness of it.
Yeah.
Where I have a problem with this grant, it builds upon folks who need help. In other words, they're going to identify junior high and high school kids who have depression in order to go and be trained to help people who are struggling with physical and mental health. I think that's too loose of a connection. They also, I think, they had two grants, so forgive me if I'm confusing components here, that they're going to hire a mental health specialist of some kind. And now we've got a mental health specialist working with schools to find kids with depression who might want to help with an equine program. I would be more amenable if we're looking to support RAINS for their equine assisted mental health. Rather than the Be Well. I think the Be Well is a little wonky in the way it was explained. So I got concerns about the model, not about the intent or about the research base.
Understood.
And the measurability. We got too many layers going on there to be able to get any metrics at all.
Yeah.
Yes, and if I may speak to the metrics, I'm looking at the number of participants in our service area. And for the life of me, like I said, it is a good, well-intentioned program, but it does not meet the criteria. We cannot justify, in my opinion, we cannot justify the kind of funding that they're requesting for the low amount of recipients that are going to be participating in this program. If they were to request the monies in another format, in another type of program that had more specific performance of the program and how they were going to be applying it and the outcomes, I would probably be more agreeable to it. But this to me is a real conundrum, because I really have seen the progress that RAINS has gone through in the program over the years, and I've been here 23 years, but I cannot stand in front of the community and say, yeah, I think we should spend that amount of money on the RAINS therapy program for 15 people or something along those lines. I just can't do it. So I cannot make my recommendation to move forward with it.
If I may just add, unless I'm misreading this, because I agree participant level is important, but this says that the Be Well volunteer program would serve 1,500 and the therapeutic horsemanship program would serve 200. So I think the participant rate might be okay, but I'm with you on the other issues. Just for clarification.
Okay.
Yeah. So I don't know, Chair, would a way forward be to look at see if there's any unanimity around the equine assisted mental health program, or?
I would be open to that. I think I actually mixed them up here on here. I agree with your comments earlier about the volunteer program. I think that was a little bit hard to I guess quantify what they're trying to do there. I would pull back my motion.
Yeah, I was gonna say, do you wanna just vote the motion?
I'll just withdraw the motion. If I could make a second motion to support program 22, the therapeutic horsemanship program. Like I said, I think it's a good program. I think it definitely benefits the community. says that it would help up to 200 people in our community, and I believe it's the only grant that provides any sort of services for the special needs community.
And veterans. They,
So that would be my motion to support number 22.
at some level. to
At
be
some
determined.
level?
Okay,
Okay.
I'll second that motion.
Okay.
Any discussion?
Good.
No, if we could do a roll call.
Director Stansett.
Good.
Director Morales.
Aye.
Director Lynch.
Aye.
Director Jeffrey.
Aye.
Director Brown.
Aye.
Thank you.
Do we have any motions for any of the other programs in the red, or potential motion for the Voices for Children program?
I don't have any additional in the red.
Okay.
But I would like to resurface the Voices for Children.
Absolutely,
So you want a motion before
please.
this got, okay. I move that we consider Voices for Children for funding.
I would second that. Any discussion?
Again, I certainly understand and believe the program looks like it's a good program. Where there are duplications of service and funding, I believe that it's not responsible for us to do somebody else's job, so to speak, with the resources that we have. And through my experience, I have found that the county of San Diego has plenty of resources available to do that for our children who need a voice. Every one of the foster children that I have had under my roof had a court-appointed attorney that spoke very well in representing them. Sometimes too much, in my opinion. Because when kids are told what rights that they have, and they don't have to take a shower if they don't want to take a shower, that's a problem. But I get it. I just don't see that as something that we should be putting on.
Fair enough.
Any other comments on that?
I would have to agree with Terry. I have a problem with dealing with the court system with regard to our community. We are unincorporated in our area that we serve. And I think, I know this is a new program as well, so I really appreciate the efforts that they're putting forward to try to start something up, and perhaps they ought to take this and present it to the county of San Diego and ask them to fund the program for the specific non-incorporated areas of the areas that we serve.
Just a point of clarification. It's a new program for us. It's a highly established program countywide. It's been around for years. So just to clarify.
Okay. It's the first time I've seen it requesting funding.
That's what I'm saying. It's new
They're
for
only new
us.
to us.
Okay.
They're not new
us.
to the county or a brand new program in
Right.
any.
It's a
I-
nationwide.
Okay, thank you very much.
Mhm.
I'm not wearing my positive government hat today, so I still stand in a position to say, I don't think so.
No, I think your point's well taken in terms of the overlap potential. I think clarifying that in part of the grant would be very helpful. It's a relatively small amount of money being requested. I think it does fit under the umbrella of what we're trying to do versus some of the other grants that have been written. So for me, the next process is, how we may juggle the cutoffs, if you will. And again, back to my comment about what's the next 20,000 bias in terms of these programs, in terms of gap fulfillment. And I don't have a sense for that in some of the grants in terms of where the true gaps are and what the next level would be fulfilling those gaps. So it's a little hard to kind of draw that cut.
Yeah, sure.
But
Loading.
Okay, we'll just go to a vote here.
Director Stansett.
but
Director Morales.
Voices for Children.
On whether we should, for consideration, I say no.
Director Lynch.
Aye.
Director Jeff.
Aye.
Director Brown.
No,
Thank you.
Okay, so I don't think that we have any other grants that we'd like to take a look at. Correct me if I'm wrong, but I think that we have kind of the roster of what we're looking at. I guess the next phase is kind of moving to amounts.
Only if there's a recommendation to deviate from the approved,
No, the requested amount.
the requested amount, right?
Okay, do we have, can I have a motion to approve, the grants, in full, in their full amount?
You need to make a motion. I'll make the motion just for discussion.
Second?
So, hold on, make sure we're getting this correct.
What is
Yeah. So Terry, you're going to go ahead and make the motion that of the grants that we have approved, you're willing to entertain a discussion further on amounts.
Oh, that was not the motion that Bill suggested. It was that we approve the amount that they had requested.
Okay.
And I'm just making the motion so we can have that discussion.
Okay,
Do we have a second on that?
I'll second that.
Okay, let's have a discussion, okay?
Well, I think that we ought to go through each one that we have, are willing to approve and to talk about the amount and why we're okay with the amount.
Okay.
And then if we're not okay with the amount, we need to.
Okay.
So that's the only reason I made the motion is to have it.
Sure. Anybody else on that particular motion? Or everybody's comfortable, you wanna go?
No, I would
one by
agree.
one?
I would agree with Terry, and based on the fact that he's our treasurer and he knows our budget, and he's gone through the same assessment process as we all have. I think that the ayes or the nays should be looked at the end of the discussion. And the amounts that they are requesting need to be discussed, because perhaps there's a variance that we would agree upon for whatever reason, and that should be taken into consideration, so that there's not just a, no, it's out of the program.
So we're looking for a no vote on this motion.
Yes.
Okay, Mike, do you have anything on the motion?
I'm confused. A no, we're looking for a no vote.
Because the motion is to prove everything as it stands. That's what's been requested.
Yeah,
And
I'll take his comments, and if we don't get that, then we'll just go ahead one by one, if that's all right. Mike, do you have anything?
So it's the entire list we're talking about here?
it would
Or
be
they were green and gold?
everything in green.
Yep.
And everything in gold.
Okay,
At this point have been essentially
Yes.
approved
right.
to move forward for funding.
Well, voices got moved down, and.
But
grants got
it-
moved down, right?
No, Voices was essentially approved
Approved,
into
okay,
the
you're right.
list, yeah.
And that's not how I see it. I see voices as a separate motion.
But yes,
And so it was carved out.
yes, but it was subsequently approved into 3-2.
Yeah. Okay, so, I think at this point, let's just, I don't know if we're gonna do a vote, just so we get through the motion, and then we can just go, item by item.
Would you let me just withdraw the motion?
That'd be fine.
That'd be
Yeah.
cleaner.
Okay, awesome. Do we wanna go, just through the list and take a motion and then discuss each one? Is that the process that we need to do?
I
that?
think at this point, that's gonna be more straightforward.
Okay. The first, one that we'll look at is Boys and Girls Club Triple Play. Amount requested, $40,033. Can I have a motion to approve, that amount as requested?
I would like to make that motion to approve that amount as requested. And the reason I'm saying that is because in the 23 years that I've been here in Fallbrook, I can honestly say that the activity in the most positive way of the Boys and Girls Club and their impact on the community has just been phenomenal. So I applaud their efforts, and I would most wholeheartedly say yes to the Triple Play program.
A second,
I'll second it.
okay, discussion?
I would say they're asking for an amount of money that makes sense. They cover 4 of our priorities. They have a track record, their finances are in order, and they serve all incomes.
Absolutely. Can we have a roll call on that?
Director Stanislav,
Approve.
Director Marat.
Aye.
Director Leach.
Aye.
Director Jeff.
Aye.
Director Brown.
Aye.
Okay, next up, it's grant number 8, Fallbrook Food Pantry Alleviating Hunger. Grant amount requested is $75,000. Can I have a motion to approve?
So moved.
Second,
I will second that.
discussion? Okay, seeing none?
Director Brown,
Aye.
Director Jeffries,
Aye.
Director Leach,
Aye.
Director Marat,
Aye.
Director Stanisek.
Aye.
Thank you.
Next up, grant number 17, Foundation for Senior Care, Senior and Disabled Transportation, requesting $50,000. Can I have a motion to approve?
I'll make the motion to approve.
Second,
I'll second it.
any discussion? Seeing none?
Director Stanisek.
Aye.
Director Marat,
Aye.
Director Leach,
Aye.
Director Jeffries,
Aye.
Director Brown,
Aye.
thank you.
Okay, next up, we have, grant number 20, Michelle's Place Cancer.
This number one.
Boys and Girls Club Summer Swim State.
Grant one.
Grant number
Sorry. Apologies. Boys and Girls Club Summer Water Safety Program, they're requesting $17,225. Can I have a motion to approve?
I'll make the motion.
Second,
Second.
okay, any discussion? See none?
Director Brown,
Aye.
Director Jeffries,
Aye.
Director Leach,
Aye.
Director Marat,
Aye.
Director Stanisek.
Okay, finally on to grant number 20, Michelle's Place Cancer Resource Center, mental health for cancer patients, requesting $27,234.
I'd be happy to make that motion.
I'll second.
Any discussion? See none?
Director Stanisek.
Aye.
Director Marat,
Aye.
Director Leach,
Aye.
Director Jeffries,
Aye.
Director Brown,
Aye.
thank you.
Grant number 15, Foundation for Senior Care Door to Door, requesting $11,000.
So moved.
Second.
With the understanding that we're exploring additional funding.
Any additional discussion?
I'm sorry, what was your comment there?
That we're exploring additional.
Gotcha, yes.
Funding.
Yeah.
Through a potential MOU process, not through a grant process.
Right, not grants, separate.
Director Brown,
Aye.
Director Jeffries.
Aye.
Director Leach,
Aye.
Director Marat,
Aye.
Director Stanisek.
Aye.
Thank you.
Grant number 16, Foundation for Senior Care Advocacy, requesting $47,000.
So moved.
Second.
Discussion? See none?
Director Stanisek.
Aye.
Director Marat.
Aye.
Director Leach,
Aye.
Director Jeffries,
Aye.
Director Brown,
Aye.
thank you.
Michelle's Place, Cancer Resource Center, Health, Education and Outreach, requesting $21,428.
I'll make the motion.
Second,
Second.
any discussion? Seeing none?
Director Stanisek.
Aye.
Director Marat.
Aye.
Director Leach,
Aye.
Director Jeffries,
Aye.
Director Brown,
Aye.
Okay, moving to the next section, we have grant number 6, Palomar Family Counseling, Healthy Body, Healthy Minds, requesting $51,860. Let's have a motion on that.
So moved.
Second,
Second.
okay, discussion on that one. Any discussion? Okay, seeing none?
Director Brown,
Aye.
Director Jeffries,
Aye.
Director Leach,
Aye.
Director Marat.
Aye.
Director Stanisek.
Aye.
Thank you.
And I would just note, if any of the directors have any sort of discussion or you'd like to discuss potentially changing the number, feel free to do so in the discussion portion, and we kind of look at that. Grant number 12, Fallbrook Senior Center Congregate Meal Program, requesting $47,000. Motion approved.
So moved.
Second. I'll second that. Any discussion on that item?
So what is the general feeling about this? This is the program that we've supported for a fair amount of time.
We've supported this a great many years.
Mhm.
This program, if I am to understand, is the meal program that is at the center itself for the community, for those attending, they wish to come to the center, and they do this on a daily basis.
Correct.
Absolutely.
Yeah.
Yeah, I think for me, I think it's definitely a valuable program for the community and for our seniors to be able to, interact with the community and kind of get out there and get out of the house is definitely, it's a great benefit to me. So.
No one likes to eat alone. I mean, maybe you do, right? But for the most part, I think the interaction there, and I've seen it in process and in progress over the years. And it's a welcome asset to our community to have a center there that provides this kind of nutritional support to our seniors on a daily basis, and they can go there and interact and have a lovely meal. And I just think it's a plus.
I agree, the socialization.
Very
is the
important.
nutrition,
And
absolutely.
they have excellent programs, and they have been supporting the district's efforts for as long as I've been here. So I say, go for it.
Yeah, I feel like it fits very nicely under the umbrella. This is one of those ones that I was questioning in terms of, who's getting turned away at this point, and is there any opportunity there? So this is one of the ones I was kind of flagging in terms of potential gap filling. So something I want to add for next year's process of what gaps exist today and how we fund those gaps, as we go forward.
Yeah,
Also part of the decision criteria.
absolutely. Can I have, any other discussion on that? Okay, we'll just do a vote.
Director Stanislav?
Aye.
Director Morales?
Aye.
Director Leach?
Aye.
Director Jeffrey?
Aye.
Director Brown?
Aye.
Thank you.
Okay, next up, we have grant number 4, Fallbrook Family Health Center. It's the Teen Wheel Program requesting $30,000. Can I have a motion to approve that?
I make that motion.
Can I have a second on that one?
Refresh my memory on this one.
I'll second the motion. Is there any discussion that you guys have as you're kind of going through your grants?
Can you bring me up to speed on this one, right? This is not a new program, this is.
This is a new program for them and being brought forward to us. And the general expectation for this program is to be able to provide more emotional and behavioral mental health support for youth programming that they're going to be doing in part at education and within their facility.
At the Fallbrook Family Health Center, which is one next to Northgate, or is it the?
Yes, it's that one. And then they will also be doing it at the school sites that they're at.
So they are interacting with the schools as well. Okay.
Correct.
They're going to Potter, right?
Yes.
That's the one that goes
Yeah.
to Potter.
Yep.
I have to applaud this program because I think it's one of the few programs where teens have the availability for confidentiality for treatment and assessment. And they've been working with the community to provide mental health for quite a while now. So I'm hoping that it's going to continue to improve because we've got challenging times ahead of us. We can keep our teenagers focused. I know they can go to a safe place and have their issues addressed. I think it's a good thing. So I would say yes on that program.
And Barbara, I would second your feelings on that, and I'm glad to see they've got a goal of 90 participants. I think that's really ambitious. I really like the teen ambassador aspect because that not only tends to their needs, but it teaches them how to radiate out. And I did appreciate their formal and systematic entry into the program. So it's really thoughtful with their school partners. So I agree with you.
Thank you.
One of my concerns with regard to this, and I actually agree with you with the prospect of positive results with this investment. The concern that I have is that no place in there are they proposing to provide any services for the Bonsall School District, partnering with them, not one.
Okay.
20 places where they talk about the Fallbrook district and the schools there, but not one for Bonsall. And I represent Bonsall. And I'm concerned that there's um, no assistance being offered to them particularly.
Would it be?
Perhaps, perhaps a thought on that, since this is a brand new program. We could work with them to do some outreach there, and then next year, pending the program being successful, it's their first year, that we assure them.
That still leaves out the people that are in Bonsall.
Right, but I'm saying,
Yeah, but why should they have to wait a year?
Maybe
would we be willing to fund more?
That's up to them. Their program that they proposed what it proposed.
Yeah.
Okay, it did not include Bonsall.
And I think this is a good point for future for the strategic planning committee as they review our process here. If we're going to have a sense that all programs proposed should serve all areas, we should probably build that into the.
Yeah, if they're not gonna cover Bonsall, that's fine. I mean,
Yeah.
if that's the limited scope of service they want to provide, then that's up to them. Just know that it's gonna have an effect on
Right.
at least whoever's covering District 5. Yeah. And Bonsall's getting to be a pretty good sized community in and of itself. Yeah.
May I ask if Rachel, if you are aware if Alomar Family Counseling is servicing Bonsall as well?
It is not,
It is not.
according to what's in their proposal.
Well, for this grant, right?
Mhm.
Yeah, they might do something else.
Those are two different groups.
Right, but I'm looking at the overall mental
Right,
health program for the Bonzo residents to have access to, so it's something to consider for our strategic planning and perhaps doing an in-service to those entities to let them know that it would be appreciated if they could work on reaching out to that section of the community.
Yeah, they need to make a commitment to cover the entire district that we represent.
Yeah,
Yeah, and if not, then they need to be able to disclose that and we'll go accordingly. That's the long and short. I don't have a problem with what they're doing, I really don't. But I have a problem with a large part of our community not getting any of that service.
yeah.
I would agree with that, I guess, in a large part. I think that, I can't really speak to their particular challenges, but I know, from somebody that's, kind of looked at the school districts previously, it's definitely a challenge because, they're all different districts. Bonsal's its own district, Vallecito's and Rainbow, so it's the same sort of thing that, if we're saying like, hey, you guys gotta get into that Bonsall district, we probably also have to tell them, hey, get into Vallecito's. And,
If
you know
we
what I'm
cover
saying?
those areas and those are where our tax dollars are coming from, guess what?
Yeah.
Then they deserve to get some representation and some assistance and service or not.
Understood. Do we have any other discussion on that item or potentially modification on the number? I don't know if you have anything on that, Terry.
Well, I would certainly suggest that it would do more justice to those that are not being served. To reserve those dollars to do something else with. Or some other program.
There's a request in there maybe that we get one cohort from Bonsall area as part of this next year.
Well, since this is a pilot,
Yeah.
since this is a pilot project,
Understood?
I don't know that we can predict. And I don't know that we require all programs that we fund to reach all areas equally. So I would ask us to consider that and ask our strategic planning
Yeah,
Sure.
committee
Yeah.
to think about that. I understand the concern. The question would be, this did get a very high score as written and as proposed. And I do like it that they're piloting a new way to reach more more youth through the health center, which means the relationship they have is based upon a base of services needed. So it is a problem. I see the problem, but I don't know that would not deter me from fully funding this to give it a fair shot and then expand out with an eye to equity. I agree with you on that.
Yeah, so for me, it's hard being a teen these days, and, you know, there's a lot of challenges that these kids are going through, on top of, a lot of them having to go through the pandemic and the lockdowns and everything that went with that. I'm certainly in favor of more mental health services for, teens and, looking at the number of served, you know, this program, yeah, 90 potential students that they're serving. If we fund it, I mean, I'd like to expand that, but I don't think that there's really any good way of us saying, hey, we'd like, you guys to ask for more money. I think that, again, this is probably one of the things that, you know, I would recommend for a community, you know, stakeholders to come to more board meetings and get into more of these discussions. You can kind of probably figure out like more of what we're looking to do here.
Then I would propose, I think that, that we modify the amount that we're gonna approve for this particular program.
So are you making a separate motion for any particular amount?
My motion is that we consider an amount other than what's requested. And we'll have a discussion on how much that will be.
Okay,
Yeah, I guess
should we go to the vote for the first motion first and then kind of go
Yeah.
from there?
What's the
Okay.
first motion?
So the first, the first motion was to approve it at 30,000, so we need to withdraw Jennifer's motion and Bill's second if or we need to make a formal amendment to the motion.
Good, whatever you want to do.
I'd like to have a motion, vote on the motion I made and see where we are.
Okay.
Go ahead and go.
Director Brown,
No,
Director Jeffries,
Aye.
Director Leach,
Aye.
Director Morales,
No,
Director Stans.
Aye.
Thank you.
then there's no further discussion. And again, I say that is really, does a disservice to a large part of our area. Quite frankly.
Number 14, Foundation for Senior Care Adult Daycare Program, requesting $32,000. Can I have a motion to approve?
I would like to make the motion to approve this adult day care program at the $32,000 amount.
Have a second?
I'll second it.
Discussion? Seeing none?
Director Stanislav.
Aye.
Director Morales.
Aye.
Director Lee,
Aye.
Director Jeffries.
Aye.
Director Brown,
Grant number 3, Fallbrook Family Health Center, SBHC BH Expanded Services Program, requesting $50,000. Motion to approve?
I move. Motion to approve.
Can I have a second?
I need to refresh my memory here.
I gotta find my note sheet.
I'll second the motion.
Thank you.
If you guys would like to get there. So,
Let me reread the program description.
please.
Thank you.
It is,
I can find my paper.
the vision of the school district is to provide health services to middle school children exhibiting social and or behavioral deficits. Program is on-site at Potter Junior High, will provide essential behavioral health services through its clinicians and will develop trust in school personnel, educators, clinicians, and students to support their vision. Again, this is the first time that they'll be doing this program, in part because they received a HRSA grant. So it is brand new to the district as well as specifically for community health systems.
So this presents us with the same dilemma.
Yeah,
It does. it
Yeah.
does.
With the same dilemma.
Flat out, it covers a large part of our district, which is Bonsall, and others. It talks about Potter, and I get Potter, you know.
Yeah.
But it doesn't do anything for the other parts of our district. They're not proposing to, and it's $50,000.
And I'm having an idea.
okay,
What we just did, what we did for, my brain is not functioning. No, what I'm thinking is, we've collectively discovered that there's this inequity going on. Could we, as we did, what did we ask you to talk to
the Foundation for Senior Care regarding the door-to-door program, to potentially move it into an MOU program.
Thank you, thank you. Could we, in order to build a bridge that could potentially help with this inequity problem, could we do a similar thing by approving this to a certain amount and then meet with our partners and problem solve this outreach to Bonsall? In other words, we could fund this, choose to fund this with $30,000, let's say, and convene a conversation as a temporary bridge until we get our strategic planning folks talking about this. We could take that 20 and sit down with this partner and say, can we find a way to expand this to the Bonsall community?
And other communities, parts of. it.
Well, but,
And if they can't, then understood, we'll just go from there.
and, correct, correct. So it's a little wrinkle in the rug, but it is a way to formalize our care and concern and genuine effort to reach out to the Bonsall folks.
Understood. Rachel, is that something you would be comfortable doing? I'm not sure if they can submit another grant or anything. It would pretty much be like, hey, next year submit a better grant and you
Well,
might get
and-
more funding sort of thing, right?
Well, what I'm proposing is we fund them 30,000.
Yeah.
And make the 20 available through an MOU conversation.
If they're
They're able
capable
to-
and able to do that with the current grant year.
Right.
Yeah, based on where the finances are going, it looks like it's, Chris, there's office supplies and training, but mostly it's the site visits.
Right.
So we're just fundamentally reducing site visits or shifting them to another area. That's what it comes down to.
Reducing in one zone and
Right.
expanding them to another.
It makes a presumption that they have the ability
I
to get
know.
into that school, but
That's
yes,
correct.
we could. If the motion is to essentially approve a grant agreement at 30,000. With the caveat that Community Health Systems approaches other school districts,
And
Bonsall
vice
and
versa.
vice versa, to specifically try and provide services there, then within this grant year, we could make the additional 20,000 available.
Right.
Yeah, no, I think that gets way too. I don't think that we need to get into a motion to do that. I'd be okay with doing the $30,000 thing. It's up to them if they want to come back and
Yeah.
and request of us. I don't think we ought to write that into our. It's not up to us to restrain ourselves or.
So would the motion say with the intention of, or just leave it at 30?
Just prove it at $30,000
Okay.
and they'll get it if they really need the money. If they want to go after and provide the service to Bonsall, which I think they should.
Yep.
Then they'll come back and then they'll make that request of it. To an MOU, I'm fine with that.
Yeah.
But not during this grant year. Well, my concern about that is they need a certain amount of horsepower money-wise to hire enough people, fund enough hours to do it.
I'm not gonna give them $50,000 to do it. They need to be able to provide service to other parts of the community.
Yeah, it's a new program, right?
So we've got to remember, we're all new to having zones and those and we did not make it a priority or a requirement for them to prove service everywhere. Are we saying?
Maybe we should have been doing that all along.
Well, of course, so we're learning,
Yeah,
we're
yeah.
learning, we're learning. So I don't understand why that would be a reason to decrease the funding for them. Especially when we can give them a chance during this year to really get in there
I respect that.
and
It is not about them. It is about the constituents that we represent.
I'm agreeing with
Yeah, well, then.
you to respond well and in a timely way.
Yeah, I guess my concerns are as far as trying to get them to expand is that they asked for 50,000 for just, Potter. I would be concerned if they came back and said, well, if we want to do Bonsall and Rainbow, it's 150 or 200 or somewhere out of our budget or whatever, but, I would be up for, voting on the current motion or substituting for 30,000 and kind of just saying, hey, this is our thoughts, I definitely would agree that, the zone-based elections has kind of changed some
Our
stuff
view.
for us. For myself, I just kind of, everybody has a different approach, I try to just look at the district as a whole and, kind of treat everybody as kind of my constituents. And I know that, on some of the programs, especially new programs, it might be difficult for them to start at a level that's containing everything, so I definitely, understand your concern and I agree, Bonsal's growing, like there should be more programs for that. But from our perspective, like we publicize, hey, this is what we're trying to do. Come on in, learn how to write a grant, I just wish that, more of the groups would come proposing grants that would serve that instead of us just sitting here saying, well, like, you guys should do it,
What that says to me is that our folks here in Fallbrook are looking just at Fallbrook.
Yeah.
And, they're asking for money from us that we're gotten from a lot of different places, but to use right here.
Yeah.
That's just not right. It's just
Yeah,
not
but
right.
we want to correct it. I'd rather start correcting it more quickly than wait another year.
Yeah, well,
That doesn't ring.
it
well
doesn't
to
feel good, doesn't feel right, honestly.
I
To try and reach out now.
at 30,000, or you're making the recommendation that you would approve it at 30,000.
Yeah, I'd be willing to.
I think that's reasonable, because I'll tell you why, and it's not because, there's a prejudice here, it's because Fallbrook Family Health Center has been in business for a long time. And they know the service areas, and we've asked them to reach out before and do things down in that area, so they're aware of the community that they serve. And we certainly had feedback from them when they've been overwhelmed from all of a sudden they're getting a whole bunch of activity from a specific area, and they're reaching out for additional funding because of us and such. So all things considered, to make it an even and a win-win situation for consideration for the new program, great. I think they need an in-service again to realize that their service area is not specifically Fallbrook unless that's what they have been instructed to be doing, but we'll find this out. But I would support the funding of this program at the $30,000 level as a new program, and give them a kickstart, see what they do, and let them know you need to remember your neighbors in their surrounding areas.
Well, and again, to that point, we would need to amend the grant question to be specific. If that is going to be a judgment criteria, then that needs to be a specific component of the grant. It has not been a judgment on the grant. So if it's going to be something that is part of what your judgment includes, that needs to be communicated to the grantees.
And it needs to be
That has not been.
all programs.
Yeah, I think
That's gonna
that,
be a
I
statement.
think that should be something that we kind of look at as far as the grant rules and
Yeah.
the system that we have for
For
that.
the upcoming fiscal,
Yeah.
Correct. Yeah, I
Next
think-
year.
but
Statement of
it
coverage.
was not built into this
Correct.
set of.
Yes.
Right.
Yeah, I definitely agree with you on
Kind of a
that.
statement of coverage and a narrative around that,
We
I
gotta
think would
be
be good.
careful with that, because everything can't do everywhere.
No, but
Every
dollars,
single thing can't go everywhere.
I would
so-
agree with you, but the dollars that we have in our coffers come from this
Yes,
this
I
district.
agree.
And we have a responsibility to see that those are allocated appropriately for the best services that we can get to our community residents, including Bonsall, Duluth, and
And
Randy.
I know that the strategic planning committee will take it up, and we'll
You-
figure it out for next year.
You bet we will.
Okay,
Do we have, did you want to stay with the $50,000 motion or would you like modify?
I'll withdraw it. Clear the field, allow somebody to.
Would anybody like to make a motion on that particular program or an amount? Nothing. I would move to support the program for 30,000 for the first year and kind of see where it goes. And hope next year that they can expand, or if it's a positive program that has positive results, it could potentially expand.
You don't want to put that in your motion.
Yeah.
Those wishes and dreams and stuff.
Okay.
But I would move that for $30,000.
I would second that.
Discussion?
Dr. Brown?
Aye.
Director Jeffries?
Aye.
Director Leach?
Aye.
Director Morales?
Aye.
Director Steinison?
Aye.
Thank you.
Okay, I'll just take them in order here. So, the next one I'll do is, Voices. We pulled it out of there, but we'll go ahead and discuss that one now. Voices for Children, Court Appointed Special Advocate Program requesting $15,000. Motion to approve as written.
I'll move, $15,000 funding for Voices for Children for discussion.
Second. I'll second that. Discussion?
Well, as I stated earlier, those kind of services, to my mind, are well funded through the county of San Diego. There is no lack of legal representation and advocates for our children that are in the system. And I can tell you firsthand, they really get good service out of the county. Especially with their legal representation. And I just don't see that as proper use of our resources.
Understood. Any other discussion? Yeah, good. Okay, we'll go to a vote.
Director Steinison?
50,000.
No.
Director
Jason?
Morales?
No.
Director Leach?
No.
Director Jeffries?
No.
Director Brown?
No,
Okay, do we have another motion for a separate amount? We've already approved the program for funding. I would move to support the program for 10,000. Have a second on that? Okay, well. I'm not sure, would the board like to not fund that particular program? We've gotten to this point where we've approved it for funding. If you voted to approve it for funding, do you have a certain funding level that you're looking for, or?
I'm taking into account the firsthand experience of my colleague. Although I totally believe in CASA, it doesn't feel like it's the right fit for us right now, so that's why my position has shifted on that.
Okay, can I have a motion to remove the grant from consideration?
I'll make the motion.
I'll second that.
Any further discussion?
Dr. Brown?
The motion is to remove I.
To
Director
remove
Jeffries?
seven.
Aye.
Director Leach?
Aye.
Director Morales?
To remove? Aye.
Director Steinison?
Aye.
Next up, we have grant number 5. It's for Palomar Family Counseling Services. It's a program, grandparents raising grandchildren. They're requesting $15,000.
I so move.
I'll second.
Discussion?
I just want to say this is a homegrown program for us. It was born in the community collaborative 4 years. It was before COVID, so it's been longer than that. And it's really taken root. I love it that it's coming back and it's so successful, and I will vote for it.
Absolutely. Anything else?
Director Steinison?
Aye.
Director Morales?
Aye.
Director Leach?
Aye.
Director Jeffries?
Aye.
Director Brown?
Aye.
Thank you.
Okay, I could be wrong, but I think our last one here to discuss is item 22, Reigns Therapeutic Horsemanship Program, Equine Assisted Mental Health, requesting $39,000. Can I have a motion to approve?
I also move for discussion.
Can I have a second? I'll second. Any discussion?
I would just question if that is really, our best use of resources, given our vision and our mission. We certainly can take anything and stretch it out there and suggest that it has some positive, health benefits. Honestly, I just don't see this as being one of them.
And I'll reiterate my concern on measurability and, connection with, effect. And I'm still in a quandary on that.
I would support my colleagues on their position as well. I've been here 23 years. I've watched brains grow. I've seen them do wonderful work. They know the drill. They know how, the grant applications are to be, written and what we're looking for. And, they have a wonderful reputation and they have funding from other areas as well. I again can't see how we can justify to our community members this dollar amount for this program that services our area. I don't think there's enough impact locally, albeit they are fantastic and have a wonderful reputation and do wonderful things nationally. They have grown that much. They are that good. But being here in Fallbrook, or Fallbrook, Bronco, Duluth, and Rainbow, I don't think we're going to get enough bang for our buck. I'm sorry to say it that way, but that's the truth, and I can't support this.
Okay, I thought, just a point of fact, I thought, we already discussed which programs that we're gonna fund, and at this point in the process, we're just looking at dollar amounts. So,
Okay,
I'm not sure if you have any comments on that, or
did we discuss the idea of lessening the amount funded?
it would be a time to do it right now. If you have a
I would-
thought on that.
I would say as a good faith gesture that we would fund them at the maximum of 10,000 because of their history with the district. And I know that may sound, old, but at this time, when we're looking at the growth of the community and the wellness center and what demands are being put on us, what we've had to go through with COVID, I think our dollars need to be really carefully portioned out. So it is what it is.
Director Stanisek?
I think there's a reduction required but because of the lack of metrics on some of these categories, and also to fit within the district. So I understand the program. It's a great program. There's other funding sources, but I think there's other opportunities too. So as far as an amount, I would have to look at kind of the breakdown here. There's some big numbers in their spreadsheet in terms of funded people and how that may impact the programs going forward. 10,000, 20,000 seems more in line to me. But I'd like to hear other discussion on this.
Yeah,
So for me, amount won't make a difference.
nor from me.
Okay.
So yeah, my thoughts, I'll just kind of reiterate what I already said. I think it's a great program. I think that, the idea that, it's not proven or that it's not, quite, science at this point are, I think to me just not correct. I think it's a great program. I think that we would be hard pressed to find some sort of metrics that you could use to score a program like that. I think that it's, what are we looking for? It's a program that's in our community, that's grown up in our community, and that fits the health needs for people in the special needs community. I think that as a district that we would be sending the special needs community down the road if we just chose to not fund any programs that address their needs for this fiscal year. Personally, I wasn't part of the discussion in the last grant cycle, but they also were denied last year for a number of grants. So my thoughts are it's a great program and that it should be funded. I would be totally in line with funding for 39,000, but would be open to any sort of discussion regarding lesser amounts. But like I said, I think that when we're looking at communities within Fallbrook and Bonsall that we're looking to address the health needs for, we've addressed for the senior community, we're looking to address for youth. And I think that the special needs community is another subset that we should be concerned about. I mean, they're not always out there in the front of things, but they're a community that needs help and support. And when we have an award-winning program in our community like Reigns, I think that we should support it. So that's just my 2 cents.
Well, you're
Well, sir.
You're starting to get my ear, because I'm noticing there are only two special needs programs represented here, Divine Path and Reins. And I'm hearing you on special populations.
Yeah.
It's just that the application was not strong enough for me to
And they've had a-
lift it up.
And they've had a history of getting grant applications to the district, so I don't understand why this they didn't give this the attention or priority to meet the requirements to consider, the funding.
Well, just kind of my thought on that, or, as a district in the last, number of years, we've definitely changed our metrics as far as what we expect from the grant recipients, as far as when we've changed to, the social determinants of health and being able to say, hey, like, show us which social determinant of health that, it's affected. I think prior to that, they just turned in an application and said, hey, this is what we're looking for. And didn't have to necessarily meet
Right.
such criteria.
Reputation.
So I think from our standpoint in the last couple of years, our process has changed a bit.
Yes.
So that's kind of my thought or whatever.
Yeah.
Well, we've just made ourselves more accountable, and there's nothing, we don't have to apologize for doing that. That's our responsibility, is to be responsible in how we're managing.
The measurable
resources that we
outcomes.
have.
Yeah, exactly. The metrics, yeah, it's more
Yeah.
important.
Okay, well, we have a motion and a second. I don't know if, it doesn't seem like anybody has any
What-
substitution or anything. I don't know if you guys want to go to a vote on that.
What's the motion?
So, yeah, the motion did not specify, an amount below the 39, and there doesn't seem to be an appetite for the 39, so if that vote at 39 was taken now, we would have to take and do another motion
Well, no,
specific to an amount.
If you have an approved motion on the table, we either have an obligation to vote on it, or the person who made it needs to withdraw it.
And Jennifer, you made the motion
For discussion.
for discussion.
Okay, I'll withdraw that and, clear the field for an amended amount if somebody feels so moved.
Well, I would again, I would make a motion to approve them for 30,000. And again, I would just, again, point out, the special needs community is a big part of our district. And if we're looking to, help Reins out and also the special needs community, maybe give them an opportunity in the future to, clean up some of their application errors. I mean, I definitely would be up for funding them for 25,000. I got a second on that.
So the amount is actually 25,000.
Oh, sorry, 30,000.
30,000. So we need a second.
For the second, for the grant number 22, you're talking.
Correct.
Yes,
So Mike, are you making that second then?
I'll second it.
Well, if we have discussion, or you guys just want to go to a vote?
Director Stenizen?
Aye.
Director Maraz?
No.
Director Leach?
Aye.
Director Jeffries?
No.
Director Brown?
No.
Thank you.
Do we have any other motions for this item? No motions for this item. Okay, well, do I have a motion to remove it?
I'll make the motion to remove it to clean up the records.
Second?
You're proposing to remove it from
From the list of approved grants that we've already approved to fund.
we've approved, the pink section.
We didn't approve the pink section, but we pulled item 22 and it was moved and approved 3-2 to promote that program. When we got to the funding section of the amount, there was no, agreement on that, so,
Okay.
said, just,
So the current motion is that Barbara has proposed is to remove grant number 22 from the approved list. Which undoes one of our previous.
Okay.
It's
It's
just for,
votable.
it's just for bookkeeping, cleaner bookkeeping.
I got you.
we're either gonna discuss funding the program or we're not. If we're not gonna discuss funding the program, then we need to remove it and just kind
Yeah.
of move on.
Okay,
So,
I would say remove it and move on.
So I need a second.
Is there a second?
One second.
Any further discussion?
I would just again say like, you know, again, I'm disappointed in the board, at this point for, you know, not recognizing the needs for the special needs community. And I think that that's a big part of what we've done prior to this and that we should be doing. So that's just kind of my thoughts and, take it to a vote.
Director Stenizen?
No.
Director Morales?
No,
Director Leach?
No,
Director Jeffries?
Well, the
Wait,
motion is
wait.
to remove it.
The, the motion is to remove it, so no means we keep it as approved.
Okay.
Yes means that we choose to remove it, so your vote is still no, you
Yes.
wish to keep it alive.
yes,
No,
Jeffries?
No for further discussion.
Director Brown?
yes to remove it.
okay, so, we're still on that item then. You know, if I could, maybe one of the directors had voted to continue with the program. I don't know if you have a substitute for an amount or any thoughts on, you know, what would lead to, your approval of the item?
Well, I'm speaking on, for the fact that there's, the program is serving a special need that we are not currently covering well. I heard the discussion and I think with the funding, we can still maybe move forward, but continue to monitor this for metrics.
Yeah.
Coverage and impact. So I don't want it just with zero. But at the same time, I think there's some learning we need to do over the year here to see how this fits in the overall strategic planning.
Okay, well, I moved. My opinion is shifting. I've been an admirer of this program forever. I get what Bill's saying about the special needs community. And I'm willing to consider, I'll make a motion to fund at the $25,000 level.
I would second that. Any discussion?
I certainly understand the desire to provide some service for our constituents, our citizens that are in need of some mental health, those that are disadvantaged, physically and mentally, the MDs, the DDs. I get that. I just don't see this as the program to do it. We have several other programs in here that, when we read through their proposals, some did address the needs of the mentally disabled and developmentally disabled. In my mind, this is just not the program for our resources.
Which should, we're gonna go, to a vote.
Brown?
And the motion is 25,000? No,
20.
25.
25.
I don't know.
Director Jeffries?
Aye.
Director Leach?
Aye.
Director Morales?
no,
Director Stenizen?
Aye.
So that's approved at 25,000. Okay. Alrighty, I think that's all.
Can we take a quick break?
Yeah, well, do we need anything else
We can do a
besides?
recess for.
I mean, I think we're pretty well done now.
Unless you have anything else, that's all of them on the list.
Yeah, I could just adjourn.
Okay.
That's fine.
You didn't get a
Uh,
paper, right?
Yeah, I can wait for that. We approved the amounts that you saw. I appreciate all of the groups for coming out. You know, I hope that some of you kind of learned from our process here and what we're trying to do. And again, I've said it a number of times this year, please come to our board meetings. You'll get a better sense of what we're trying to do and accomplish. And we thank you all for putting in your funding requests. And if there's any of the groups that didn't get funded or you have other programming, I would recommend to kind of talk to Rachel about potential opportunities for MOU. We have a strategic planning workshop coming up next month, and that's one of the discussions that we'll be having is how we can kind of fund some of these programs in a way that's not in the grant process. So I would again reach out and feel free to reach out to any of the board if you guys have good ideas for programming. I think that we're definitely in favor of trying to promote great programs in town. And that's it for me. Any comments from the board before we adjourn? No, good. Okay, we'll go ahead and adjourn. Thank you.